So let's start with the basics. Medicare is split into four parts: Medicare A, B, C, and D. Over 59 million Americans are covered by Medicare, and Medicare is run by the Center for Medicare and Medicaid Services, also known as CMS. I'd like to kick it over to Angela at CMS to talk about Medicare eligibility.
I'm Angela James at the Centers for Medicare and Medicaid Services, and I'd like to tell you about Medicare enrollment periods. Some people get Medicare automatically, and that means they don't have to do anything to sign up for it. If you're already getting benefits from Social Security or the Railroad Retirement Board, you will automatically get Medicare Part A and Part B starting the first day of the month that you turn 65. If you're under 65 and disabled, you'll automatically get Part A and Part B after you get disability benefits from Social Security for 24 months. If you're automatically enrolled, you'll get your red, white, and blue Medicare card in the mail 3 months before your 65th birthday or the 25th month of disability benefits. Now, if you don't get Medicare automatically, there are certain times throughout the year that you can sign up. First, there's the initial enrollment period. You can sign up for Medicare during the 7-month period that begins 3 months before the month that you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. So for example, let's say that you turn 65 in May. Your initial enrollment period would run from February through August. If you enroll anytime in February, March, or April, your Medicare coverage will start on May 1st. If you enroll anytime in May, June, July, or August, your coverage will start on the first day of the following month. Now, if you don't sign up for Medicare during your initial enrollment period, and you aren't eligible for a special enrollment period, which I'll explain in a minute, you can sign up during the general enrollment period, and that's between January 1st through March 31st each year. Your coverage will start on July 1st of that year, and you may have to pay a higher Part A or Part B premium for late enrollment. Once your initial enrollment period ends, you may have the chance to enroll during a special enrollment period. In most cases, you get a special enrollment period if you didn't sign up for Medicare when you were first eligible because you were covered under a group health plan based on current employment. The current employment could be yours, or it could be from a spouse or a family member if you're disabled. A special enrollment period means that you can sign up for Medicare anytime you're still covered by the group health plan, or during the 8-month period that begins the month after the employment ends or the coverage ends, whichever happens first. Usually, you don't pay a late enrollment penalty if you sign up during a special enrollment period. So here's another example. Let's say you retire on March 30th. To avoid a gap in coverage, you should enroll in Medicare in March before your employer coverage or employment ends. If you don't, your special enrollment period would run from April through November. If you enroll during one of these months, your coverage will start on the first day of the following month.
Next, let's talk about some important dates to keep in mind. Angela already talked about your IEP, your initial enrollment period. That's the 7-month window surrounding your 65th birthday or when you first become eligible for Medicare. At that point, you're given guaranteed issue status for a Medicare supplement, Medicare Advantage prescription drug plan, and once that IEP is met, you're now on the same calendar as everybody else, where October 15th through December 7th each year, you're given an AEP, an annual election period. At that point, you can switch to Medicare Advantage plans, your drug plans, your supplements. You can make changes during that period. Now remember, during an annual enrollment period, whatever selection you make becomes effective on January 1st, and it runs the next calendar year. Another thing to keep in mind is your open enrollment period that's January 1st each year. During that window, you're eligible to switch your Medicare Advantage plan from one to another. Almost think of it like a buyer's remorse, where if your plan doesn't have a doctor or a drug or something you want, you can make a switch from one Advantage plan to another during that period. Other than that, it would take a special enrollment period status to make a change. So throughout the year, if you move in or out of the plan service area, so if you move from one state to another, you have to switch plans. If you come off of group coverage, you retire, you're given a special enrollment period. Other things that would fit into this bucket would be if you are diagnosed with a qualifying chronic illness, if you qualify for a low-income subsidy or get extra help from the government, Other than that, you really are stuck in the plan you chose, so choose wisely.